Today I'm going to be talking about iron deficiency. This is an important topic, and the reason that I'm bringing this up today is because recently I had a client who came to see me. I'd seen her a few years ago for digestion issues, and she came back and said, I think I've got gut issues again. I'm really fatigued, I've got no energy, can't even exercise anymore, I have shortness of breath, heart palpitations. And I said, well, have you had any blood testing done? She said, yes, everything was fine. Doctor said there was nothing that showed up. And I said, well, send me a copy anyway and we'll have a look at them and just make sure everything's in the optimal ranges. And when I got the test results, which you can see here, the iron was below range, iron saturation was super low, everything was out of range except for one marker, which was ferritin. And this is arguably the most important marker for iron deficiency, but it's also elevated when someone has inflammation. And they also had their C-reactive protein tested, which was super high also. So they had a lot of inflammation, which was giving this false elevation of the ferritin. So I explained to them that they had these super low iron levels. It may not be digestion, or it could be caused by digestion. So in today's video, we'll explore why iron is essential, the symptoms of deficiency, who is most likely going to experience iron deficiency, and of course, natural treatments to help you maintain optimal iron levels. Iron is an essential nutrient, but finding the right balance is key. Too much iron can lead to chronic diseases, and there's a condition called hemochromatosis with that, while too little can cause symptoms like fatigue. So why do we need iron? Iron plays a vital role in our bodies. It produces red blood cells, hemoglobin transports oxygen to our cells and tissues, myoglobin stores oxygen in muscles, and it helps with energy production in the mitochondria, DNA synthesis, and cell division. Iron is crucial for enzyme production, which aids in creating new cells, amino acids, hormones, and neurotransmitters. So it does a lot, as you can see. Iron is particularly important during childhood and pregnancy, as well as for women of reproductive age and the elderly. Women are at higher risk due to menstruation, especially if their periods are heavy. Children need iron for growth and development, and the elderly often have decreased iron absorption. Vegetarians, vegans, and athletes are also at risk. Plant-based diets often lack the easily absorbable heme iron, and endurance sports can increase iron loss through sweat and also gastrointestinal bleeding. Gut infections and digestive disorders like IBS or low stomach acid can lead to poor iron absorption. Bacteria can use iron as fuel, worsening deficiencies if supplements are taken, without addressing the root cause. The best way to diagnose iron deficiency is through an iron studies blood test. This measures your iron levels, total iron binding capacity, transferrin saturation, and ferritin. Ferritin and transferrin saturation are key markers. Ferritin stores iron and is the most sensitive indicator of deficiency. However, it can be elevated with inflammation. So testing inflammation markers like high sensitive C-reactive protein and also A1C can help give you a clearer picture. The optimal ferritin range for women is 50 to 100, and for men it's 75 to 150, and saturation percentage should be between 20 and 40%. Iron deficiency can manifest in various ways. Here are the most common symptoms. Fatigue or tiredness, less oxygen reaches the body tissues. Weakness, general body weakness can be caused by reduced oxygen delivery. Pale skin, lower hemoglobin levels can cause paler skin. And shortness of breath and difficulty breathing during normal activities. This can lead to dizziness or lightheadedness because of low oxygen levels in the brain. Headaches, and often caused by dizziness also. Cold hands and feet or colder extremities. Brittle nails. Restless leg syndrome is a big one with iron deficiency, that urge to move the legs in the night, especially at nighttime. It's important to note that many of these symptoms can be similar to low thyroid function, so comprehensive testing for both iron and thyroid function is crucial. There are also 3 unusual signs of iron deficiency. Pica, that's the craving for like dirt, clay, ice. Spoon-shaped nails, they become thin and concave, resembling a spoon. Swollen or sore tongue, characterized by swelling, inflammation, or changes in the tongue's color. Iron deficiency can occur if you're not taking in enough iron, if you're not absorbing it properly, or if you're losing too much, often through blood loss. For example, people on vegetarian and vegan diets may not be getting enough iron in their diet. Gastrointestinal diseases like celiac disease, H. pylori, and the use of medications like PPIs can hinder iron absorption. Blood loss, whether it's through heavy menstruation or gastrointestinal bleeding, is another common cause of iron deficiency. Dysbiosis and imbalance in gut bacteria can also impair iron absorption. Bacteria compete for the iron. Bacteria in the gut consume the available iron, and also inflammation in the gut can damage the intestines, impairing nutrient absorption. Inflammation increases hepcidin production, which inhibits iron transport. And so there's multiple reasons why gut dysbiosis can cause iron deficiency. Iron deficiency is a global issue. Statistics show that many regions and groups, including women of reproductive age and children, are the most effective. So regular testing and dietary adjustments can help manage and prevent deficiencies. Several tests diagnose iron deficiency. Ferritin reflects the total iron stored in the body. Low levels indicate iron deficiency. Iron saturation percentage. This measures the proportion of iron bound to transferrin. And transferrin evaluates the body's capacity to bind and transport iron. Total iron binding capacity indicates the blood's capacity to bind iron with transferrin. And serum iron measures the amount circulating in the blood. This is probably the least important marker. Inflammation can affect the ferritin levels. That's why I've already mentioned C-reactive protein. It gives a clearer picture of your iron status by measuring inflammation. Now let's talk about natural treatments. Heme iron from animal products is the best absorbed. Top sources include red meat from like beef, lamb, venison, chicken liver, shellfish like oysters, clams, mussels, sardines, chicken, fish. There's a whole range of animal products that you can take, and liver is probably one of the best. You can mix it into stews or beef patties, and that can be a way of disguising it if you don't like eating liver. Alternatively, 2 to 3 servings of things like clams, oysters, or mussels can boost your iron levels. For vegetarian, there's non-heme iron, which is from lentils, beans, tofu, tempeh, nuts and seeds, especially like pumpkin seeds, dark lean leafy vegetables, and certain grains and dry fruits can also help boost your iron levels. They're non-heme iron, so it's not as absorbable as the heme iron. You can take things like vitamin C to enhance that absorption. And certain things will inhibit the absorption of iron. Calcium supplements, so always take calcium away from iron. And oxalic acid found in spinach, kale, beets, nuts, and tea can also affect the absorption of iron. Polyphenols, which are super healthy, potentially could affect the absorption of iron. And phytic acid from soy protein, nuts, and fiber can also affect this as well. Zinc supplements, they're best taken away from iron supplements as well to optimize iron absorption. To boost iron absorption, take vitamin C. This increases the absorption of both heme and non-heme iron. Beta-carotene from carrots cancels out those inhibitors that I just spoke about before, like tannins and phytates. And betaine HCl helps with stomach acid, aids in the digestion and absorption of iron. To summarize, here's your action plan. Get tested with an iron studies test. I recommend doing this on a yearly basis or more frequently if you're prone to iron deficiency. Address any underlying causes of deficiency. Improve your diet with the iron-rich foods that we mentioned, and reduce the inhibitors that potentially could be affecting the absorption. Consider supplements like iron bisglycinate, lactoferrin, betaine HCl, and vitamin C to boost absorption. And that's it for today. Remember, balancing your iron levels is crucial for overall health. If you found this video helpful, give it a thumbs up, subscribe for more videos, and stay healthy.